Good afternoon, I'm Dr. Ethan Colliver at Valley Sports and Spine Clinic. I'm also the clinical director at Valley Active, and with me as always,
Dave Cicchini, rehab specialist here at Valley Active.
And today we're going to talk about the hamstring. Now the hamstring is an interesting muscle because it's an eccentric muscle. That's because it has really two functions. You've got the distal segment, which works on bending the knee, but then you also have the proximal segment, and that works on extending the hip. It has this attachment site right here along the shaft of the long bone, and the problem is when most people do hamstring stretches, they're primarily focusing on the distal aspect of the hamstring. Would you demonstrate a traditional hamstring stretch for us? So right, so now he's going to bend over and he's going to feel, where's most of the stretch?
Down through here.
Okay. However, so he's doing a good stretch for the distal segment, but he's not really doing much for the proximal segment. Now, to get that, we have to really change the angle of the hip. So will you demonstrate for us a proximal hamstring stretch? Okay. So what he's doing is, here's the hip joint right here, and here's his pelvis, and the attachment site for the hamstring is here. So he's really flexing the hip like that. And when he does that, where do you feel the stretch now?
Down through here.
Okay, so it's a little closer to the buttock. So he's really getting into the proximal part. Don't let that knee come forward over the toe. Just drop your hip down. There we go. Now he can intensify it by going back and forth, by swishing. So go ahead and swish to the left. Good. And swish to the right. Good. Does it feel that as well? Does it hurt?
No, not at all.
Okay. So you could do this 20 seconds in a row, maybe repeat that 3 sets, and do that maybe 4 times a day. So you can work on the distal segment, but also make sure that you're stretching the proximal segment. All right. If you have any increased back or leg pain with this, of course, stop and talk to your healthcare provider. Good luck.